This is the Exam Room Podcast. In healthcare, data is everywhere. Patient volumes, no-show rates, annual wellness visits. But not all data reflects impact. In part 2 of this conversation, host Dr. Rhiannon Winsor continues her discussion with healthcare advisor Kathy Letendre, shifting the focus from transformation to measurement. Together, they explore a critical distinction: the difference between outputs, the things we count, and outcomes, the results that actually matter. From proxy measures to productivity pressures, this episode unpacks how the wrong metrics can lead to burnout, misalignment, and missed opportunities for real improvement. And more importantly, what leaders can do instead.
So I want to shift gears a little bit to talk about outputs versus outcomes. Everybody knows, everybody listening, I'm sure if they're in healthcare, they know that there's a lot of data out there, right? That we can look at and analyze, but not all of that data reflects impact. So I want to talk a little bit more about the difference between outputs and outcomes and why confusing the two can exhaust clinicians and distort priorities. And so my first question for you is, when we talked before, you made a really important distinction between outputs and outcomes. Can you explain that difference in simple terms for our listeners?
Yeah, I think it's a really important distinction. So I think of outputs as the things we do. These are things we can count: number of encounters, percent of no-shows. So the outputs are like counting, if you will, the things we do. Whereas outcomes are the results of the things we do. So for instance, improvement in health outcomes of patients. Instead of the output of no-shows, measuring or thinking about continuity of care, patients getting their chronic health condition managed, for instance, if they have diabetes. So outcomes, this is what we're in the business in. We're in the business of helping people live healthy lives, and the outcomes are the product of what we do, whereas the outputs tend to be the things we count and manage inside of organizations, but they're not the real reason that we do what we do.
Very good point. So how do proxy measures fit into the conversation?
So often in healthcare, we pick a measure that's close enough. So we measure something that's sort of adjacent to the idea that we're really trying to measure, instead of measuring the actual thing. I know that we'll talk about this a little bit more, but there's a technique that I use that really helps us to think through much more clearly, like, what is it that we're really trying to measure here? And how can we find the best measure of the thing that we're really trying to achieve? So I'll use an example: annual wellness visits, right? Percentage of my panel that's had their annual wellness visit this year. It's a proxy measure. I mean, at the end of the day, is it really about the annual wellness visits? No. It's a proxy measure for, are we working with the patient on preventative care approaches for their health status, right? It's about prevention and about wellness, and is not about the visit.
Right. So what I'm hearing is, just because we close these care gaps, right? We got our patients, we got enough of our patients in to get their annual wellness visit. We checked that box, but that doesn't mean that they're well.
And it definitely doesn't mean they're well, and that may not be what we need to measure, but did they follow through on the 3 or 4 referrals that came out of the wellness visit? Now we're starting to get somewhere, right? Measuring wellness, I will give you, is hard. The entire industry has been trying to crack that, not forever. But did they follow through? Were they successful in the follow-up steps that we identified? Getting to the foot doctor for that condition, getting their mammogram scheduled, right? these things that can result from an annual wellness visit, those next steps.
Absolutely. So, how can leaders help their organizations transition from a more output based thinking to outcome based thinking?
It's really a mindset shift. When we settle for measuring simply what everyone else measures, then we will keep measuring what we've always measured. I love working with organizations who are willing to revisit this, right? To say, okay, yes, I need to measure these certain things because I need to report them to on my UDS report or in this report that I have to send to this payer or this regulatory oversight body. And we need to do that. We need to measure those things. But the mindset is, let's remember, we're measuring those for someone else's mandate. Mm-hmm. Yes, we need to collect them and we need to send that report, but those people determine those things were important. What are the things that are most important for our organization, our environment, our situation, our strategic direction? And that's where performance measurement comes in. So reporting, yep, we collect and we send the report. But what is most important for our organization to improve on, that should be coming from what's important to the organization, strategically, clinically, operationally.
Can you think of an example just from your experience to kind of put this into perspective as far as practical steps that an organization can take?
I've been doing this work for a few decades now, and about 10 years ago, I found what I would say is the best stepwise approach to do this, and it's called PUMP, stands for Performance Measurement Process, and it is a stepwise process to do just what I'm describing. It helps an organization to clarify what measurement is for. It helps a team, this could be a unit team, a clinic team, a leadership team, to identify what's important to them, how to come up with the best measures that are easy enough to collect but are relevant to whatever is most important to them. And then it has a few more steps after that about how to use that information to make decisions, to initiate improvements, and then really importantly to know that those changes or improvements are making a difference. So, it's an 8-step process that folks can just jump right into wherever they're starting from.
So we're going to shift gears again and talk a little bit about the production line mentality. This alludes to clinicians feeling like they're being measured on putting out widgets rather than on their impact, right? Production rather than impact. So you mentioned, and this, I don't think that this is a secret, that clinicians are tired of being measured on outputs, especially when those outputs are held over them or forced upon them. What are you seeing across organizations?
Yes. Oh my gosh. I mean, we have gotten so focused on productivity. And what I am continuing to see across organizations is the use of productivity reports at the individual level. It drives me crazy. When we measure people at the individual level, it is seen as judgment. I think most of us have gotten out of the school situation where we were measured and judged on everything with our report cards. And so I, unfortunately, am continuing to see organizations measure at the individual level, thinking that, we do it with good intention. We think that by giving individuals their individual statistics, that is going to motivate improvement. I'll tell you, it has exactly the opposite unintended consequences. We do it for good reason. We do it to inspire and motivate improvement, but the reality is it does exactly the opposite. it creates resistance, it creates infighting, and it does not improve team-based care. It sets us up to work against each other, not with each other. You know, the last time I checked, clinicians work as part of a system. They do not have the unique ability on their own to make the kind of changes that we want in, I'll call it production or output driven. We have to change the system. We have to look at the system and systems that we work in, and that's where the real change is.
So what should we be doing more specifically? Give us your advice.
Yes, I know. It's so funny. Actually, I'm giving a talk at a national conference next month on this very topic. It's the name of our talk is From Burnout to Breakthrough: How to Improve Capacity and Satisfaction at the same time. Because I do believe it's possible. We should measure. We absolutely should measure, and those measures should guide improvement. But we need to be measuring the systems and the processes, not the individual people. So again, coming back to, let's be clear on what we're trying to achieve. Let's create meaningful measures of how well we're doing that now. And then let's involve the people directly in that work in that process or system on how to make it better. But when we hold people to account at the individual level, they're not interested in these team-based improvement efforts. And this is really where real improvement happens. So involving people directly to uncover what's holding them back, what are the barriers that are getting in the way, and what are the solutions that will make the biggest difference. They have these answers if we just ask the right way.
Absolutely. And then that facilitates collaboration, teamwork, shared ownership.
Yeah, and when people can see an improvement idea that they have come to fruition and they know that they were a part of that, they're so much more excited to come up with the second and the third and the 20th idea and be a part of seeing that change happen. I'm presenting at this conference with a client about the case study of exactly how they did this. I mean, the energy in this organization, the culture of this organization has transformed remarkably because we involved the staff.
Yes, absolutely. So that makes me think of back in my past, I was program manager at one school. It was within the same system, but I was in a different town. And I can remember being a part of these leadership meetings where we would come with our ideas, and pretty much most of them got shot down by leadership. And that really didn't make me feel like I wanted to bring more innovative ideas to conversations. And I can remember transferring to a different campus, and we were in a leadership meeting and they were asking for suggestions, and for the longest time I was just sitting there like I had some thoughts, but because of my past experience I wasn't keen on speaking up. And finally the dean called me out, and was like, "Well, Rhiannon, what are your thoughts?" And so I gave a suggestion, and she's like, "Oh, that's a really great suggestion. Maybe we should look into that." And eventually we ended up implementing something that was similar to my suggestion, which gave me more courage and more buy-in, moving forward to, share my thoughts. So that the cultures at those two campuses were like night and day. And, the second example really allowed us to grow and flourish and, really create something that was meaningful for our students.
Absolutely. That's such a great example. And, as leaders, it is important when we ask for those ideas to be willing to give a lot of them a try. Because even maybe that first idea you had wouldn't have worked out, but think about what you would have learned from that experience and how that would have helped you to think about more ideas, because we learn by experimenting, right?
Yes.
And so, for a leader to sort of reject an idea right out of the gate, I get it. I get when we have these open suggestion things, we get way more ideas than we can implement.
Mm-hmm.
But let's involve the people closest to the work to evaluate those different ideas that have come forward and figure out which ones they want to try first and second and third.
Yes, and I think it's also underscores the value of modeling the behavior, because as I saw leadership doing that, modeling that openness to hearing us and what we brought to the table, I took that and I was able to model that to my faculty and my students even, and so that created a really nice trickle down, if you want to say, or domino effect. I was like, wow, like this, I'm experiencing how this makes me feel and the buy-in that it makes me feel, and I can carry that forward, to my faculty, students, so on and so forth.
Yeah, no, I mean, I think the other thought is this idea of shifting culture. If you're going to try to shift a culture, like where do you even start? Like what's the first conversation that you might have? And here would be my guidance. One of my colleagues, Brooke Rolter, he has this great way of framing it. The first conversation to have is, what are we trying to achieve? And how will we know we've been successful? These two questions together, what are we trying to achieve and how will we know we've been successful? I think that's the place to start, to really have that conversation as an organization, as a leadership team, maybe a leadership team with a board. Let's really get crystal clear about what we're seeking. Are we seeking, like my organization was, to become the best in our industry, in our sector, in our region? Are we seeking to survive, right? Very different ideas. What are we trying to achieve and how will we know we've been successful? That's where I would start.
So you mentioned that crystal clear idea. Like, is this something that's inherent to leadership teams? Like they can get to this crystal clear idea, or is that where you come in a lot of the times and help them get there?
There are some organizations who do this well, but I would say most organizations really don't know how to do that well. It's generally a facilitated conversation, quite a bit of prep work, a facilitated conversation with the right people in the room, right people meaning the various perspectives to influence that decision. So yeah, I do a lot of work with organizations to help them be clear about their vision and their goals. The clearer we can be, the more alignment we can create. Like I think of alignment as all these arrows pointing in the same direction. So often we have our organizations going off in a million different directions. And it's all because we're not clear. Are we going west? Are we going north? Mm-hmm. Right? So I do tend to get brought into help organizations in that way to get clear on what they're trying to achieve. And then it all flows from there.
As we wrap up here, is there any other advice or suggestions you have about how that approach can help organizations connect strategy, measurement, and just implement this transformational process in a more successful way?
It's about being clear on the what, determining the why. So if we declare where we're going, then we need a way to know if we're making steady progress towards that. And the performance measurement process called PUMP, I think is the best one I have found in my 30 years of doing this work, that really is straightforward, methodical, and really brings teams the kind of clarity to know, are we making progress on the things that matter most? So one organization I worked with, we started by setting their strategy first. And then we took each strategy and we expressed it in simple terms that a 10-year-old could understand. Mm-hmm. So rather than the corporate jargon, the lingo, the acronyms, we took each element, 6 of them, and described it in the simplest terms possible. And then for each of those items, we called those the results. We then worked through what would be the best evidence of that result happening. And then how might we quantify that? So this one organization did this for their entire strategic direction, 6 things: mission, vision, and their 4 goals. But another organization I worked with, they wanted to just do it for one part of their organization. They were dealing with a particularly challenging situation. And so we went through this process of really getting clear on what they were trying to achieve, expressing that in simple language that everyone in the organization would be able to connect to and understand. And then we developed a set of just a couple of measures that were most relevant and feasible, easy enough to put in place. And so these are just 2 examples of organizations, and the way they now use that information drives action, right? They look at this information on a routine basis, and that helps them to figure out, are we making progress on the things that we said are most important? And are the improvements that we're making, are they making a difference? Because so often in organizations, we make all sorts of changes, but every change is not an improvement. And with good way of displaying our measures, we can see whether the change led to an improvement or not.
Thank you for describing that. I think this has been such an important conversation, and I appreciate you, sharing your wisdom with us. Are there any other thoughts before we finish up?
No, I mean, we've covered a lot of ground, from transformation to clarity to measurement. And I love working with organizations who are trying to create big change, right? Healthcare right now is such a complicated time. And if we're here to make a difference, incremental change probably won't get us there. It's time for transformational level change in our organizations, in our states, in our country. And I think the time is now to make big change, to make big transformational improvements for patients, for residents, for our communities.
Absolutely. Thank you so much for the work that you're doing and for your time today. We really appreciate it.
Thank you. It was a fun conversation.
I think what stands out to me is this. Transformation is not about doing more. It's about focusing on what truly matters and having the courage to sustain that focus over time. For our listeners in community health centers, value-based care organizations, and healthcare leadership roles, this episode is an invitation to move beyond production line thinking, an invitation to examine what you're measuring and why, and an invitation to lead transformation as a journey of improvement, not a dramatic remake. If today's conversation resonated with you, share this episode with a colleague, subscribe to the Exam Room podcast, and join us as we continue exploring how to build healthcare systems that truly serve patients and communities. Kathy, thank you for helping us think differently about impact.